All right, so having looked at diabetes mellitus, I've looked at some basic things around diabetes mellitus, which is hyperglycemia. We cannot talk about hyperglycemia without looking at a little of hypoglycemia. So we'll talk about hypoglycemia now. So hypoglycemia is simply low blood glucose. That means glucose that is falling below the normal volume or the normal level of glucose in the body. And this can be very disastrous. The low blood glucose can be as dangerous as, or even more dangerous than, high blood glucose, because low blood glucose can be very fatal. In fact, it can result in death faster than high blood glucose. So the most common cause of hypoglycemia, which is low blood glucose, that the most common is use of medications in the treatment of diabetes mellitus. So for individuals who are diabetic, what this means is that for diabetic individuals, they can take an overdose of their medication and that can throw them easily into hypoglycemia. There could be other causes of hypoglycemia, for example, a kidney failure that allows glucose to just be excreted without reabsorption. So that means every glucose that is in the body is just, once the blood gets to where the kidney is, everything goes, including glucose. So a kidney failure can throw an individual into hypoglycemia, though not very common, but it can happen. And then also the presence of certain tumors in the body that have ability to also secrete insulin. There are certain tumors that produce certain hormones that they are not supposed to be producing. And that condition is known as a ectopic hormone secretion. The hormones are being secreted from sites or from locations where they are not usually produced. So, for example, if there's a presence of an insulinoma, which is a tumor that has the ability to secrete insulin, now insulin will now be secreted in excess. And so, because insulin is secreted in excess, glucose will be broken down in excess, driven into the cell in excess. And as long as the glucose is there, it is used in the formation of ATP. And sometimes when it's too much, it's converted to lipids. The individual that now needs the glucose, when the individual needs the glucose is not available. So it can result in hypoglycemia. Then also liver disease in certain liver conditions, it can cause hypoglycemia. And then in starvation or fasting, maybe the person is starving, there's no availability of food. That's another cause of hypoglycemia. And then in fasting, some people can say they are on fasting for dry fasting for 7 days, for 14 days, for 21 days. When you check the glucose level in those individuals, glucose levels be very, very low. Then also in certain infections that affect certain infections in the body that can cause hypoglycemia, or certain drugs. Somebody is on a particular medication and the drug, apart from doing its own function, is having impact also on the glucose level. But whichever cause, all those other causes are minor causes. The major cause of hypoglycemia is medication overdose in the treatment or in the control of diabetes mellitus. Now, it may also happen in newborn babies. It also happens in newborn babies that have not eaten for a while or for a few hours. It can easily happen in babies as well. So now, hypoglycemia have some symptoms. There are certain symptoms that are associated with hypoglycemia. And the symptoms may occur the symptoms may occur um, early. It may occur early for some people, and then for some people, it may start manifesting late. But among the symptoms you find in individuals who are hypoglycemic include hunger. Of course, you know that when you have not eaten for a long time, it begins to show in your body, even if whether it is deliberate or not deliberate, even if you are fasting and that one is deliberate, it can happen that you begin to feel hungry, like you need to eat. You are the one now telling yourself that no, it's not time for me to eat. So, one major symptom of hypoglycemia is hunger. And then other symptoms include tremor or trembling. You see the some parts will be shaking, particularly the extremities will be shaking. Legs cannot carry the weight anymore, the hands will be shaking. There's sweating, excessive sweating, there's shaking, there's palpitation, heart palpitation, and then irregular heart rate, dizziness, weakness, blood vision, confusion, confusion. All these are symptoms of maybe mild to moderate hypoglycemia. But in severe cases of hypoglycemia, symptoms include weakness and tiredness, poor ability to concentrate. You are trying to use the brain to do one or two tasks, but you are unable to concentrate. All these are symptoms of severe hypoglycemia. Irritability and nervousness are part of it. Then irrational behavior sometimes, behaving abnormally, tingling in the mouth, and then poor ability to coordinate. Now, other complications include difficulty in eating. It gets so bad that when the food now comes, you now find it difficult to eat or even drink. Seizure, the person can get seizure. The person can be thrown into unconsciousness or even coma. So, when the bad thing about this hypoglycemia is that when it gets so severe to the point that it can throw someone into coma, when that individual gets into coma, it is more difficult to come back into consciousness than somebody getting into coma as a result of hyperglycemia. So, coma associated with hypoglycemia is more dangerous, more fatal, more severe. The chance of coming back to life is lower compared to coma that is associated with or that has resulted from hyperglycemia. So that's why I said initially that hypoglycemia can be severely dangerous, even more than hyperglycemia. So how is hypoglycemia diagnosed? Hypoglycemia is diagnosed when an individual is having a blood glucose level of below 3.3 millimoles per liter. That means blood glucose level of below 60 milligram per dl. That is diagnostic of hypoglycemia. Now, in newborn babies also, when their blood glucose, normally newborn babies, the blood glucose in newborn babies are measured. When the blood glucose of a newborn baby is less than 3.3 millimoles per liter or 60 milligram per dl, it's an indication of hypoglycemia. And at that point, it's a situation where even when the mother has not started lactating and the breast milk is not available, a solution has to be sought. Possibly the dissolution of glucose powder into measurable amount of clean water, and then giving the baby small sips to at least compensate for that glucose until the mother is able to lactate. So hypoglycemia can be as dangerous as hyperglycemia, if not more.